They come in more as a skin condition than a child, and then they realize they can shed that invisible armor that they wear when they're in the outside world and really just be the child that they are in the inside, because they're not looked at for their skin conditions. Today we're going to be talking about lessons that I learned at camp, and I hope that you learn from them too. So camp really changed my life. It actually changed the trajectory of my career as well. As a pediatric dermatologist, I knew I wanted to provide good care for my patients. And you know, when you're a learner, you're not sure exactly what that looks like. And as a medical student, I had some ideas, but then as a resident, those ideas became a little bit more clear. And one thing that really defined them was my time at camp and my time taking care of children there, because at camp they come in as children with skin conditions, and again the world looks at them as a skin condition, so they come in more as a skin condition than a child, and then they realize they can shed that invisible armor that they wear when they're in the outside world and really just be the child that they are in the inside, because they're not looked at for their skin conditions. So it was really great. It was an education outside of the classroom, outside of the textbook, that I think is just really vital. And I do believe that, you know, Camp Discovery is part of the educational journey and should be of every resident who's going to be a future dermatologist. And the ways it changed my life, again, just made me a better doctor overall. And I became a lifer. Again, that's a term that we use at camp, and if you go, you'll hear the term, and I became one of them. I started as a volunteer. I became the medical director. I then became part of the Camp Discovery Committee at the AAD level. It's a great way to get involved if you have a passion, to jump into the AAD where you have a passion. This was one of my passions. Camp is a great experience. It's a great one-week experience for these kiddos that is life-changing, but then they don't have really much after that to kind of keep them boosted up. So Made a Masterpiece is the nonprofit that kind of came from my experience at camp. I owe so much to Dr. Dahl. He is an icon in our specialty. He was the Academy of Dermatology president, and he's actually the impetus. He's the reason we have Camp Discovery today, 30 plus years later. So Camp Discovery started in Minnesota in 1993. There were 50 campers from 27 states, and that is how Camp Discovery started. And now fast forward 30 plus years, and we are in the thousands of patients and children with skin conditions who have been helped. Camp has just also changed the lives of so many residents who then go on to become dermatologists. And again, I just can't overemphasize how important camp is for not just the campers that go there, but also the medical professionals that come and just get to experience this with the children. And Howard Pride then started the second campsite that's up in the Northeast and in Pennsylvania that continues on. I would love to walk you through some of the lessons that I learned at camp. Every resident should get to camp. So if you're listening to my voice right now, go on the website and sign up to be a volunteer and get involved, because it will change your life too. Really, Camp Discovery started and has changed the trajectory of so many people's lives in dermatology. I know Megan Moore is a dermatologist. I got to be way back in the early 2000s. Her and I were volunteers at camp together, and she wrote a beautiful piece. It's called The Beautiful Place, that was published in the Journal of the Academy of Dermatology way back in 2002, but it is lovely, and I would encourage you to read that, because it just talks about the beautiful place in Minnesota where this camp started. One of the lessons that I learned was that a child really isn't defined by their disorder. And again, I think sometimes when we're in training, we look at people as a diagnosis, or we look at them as a genetic mutation. And again, that is not what these kids are. And again, I understand that those are things that we need to learn as medical professionals, and that is an important part of their care. But we do need to remember that it's the person that we're taking care of, not just the condition. And when we can holistically approach this, and again, we have so many ways that we can bring other people around to do that, to help these children really be holistically cared for. There's patient support organizations, there's the camp programs, and then again, if you are a dermatologist who's been to camp, you're going to approach your patients differently for the rest of your lives. So again, it's just taught me time and time again that these are kiddos first, and then they have their skin condition and they're learning to live with them. And it's such a treat to help them learn how to live with them at camp. Lesson number 2, medical professionals don't always know best. I know it is our job to be the experts. And I think, it's important that we become the experts on the medical conditions, but these kiddos live in their skin. They know what it's like to live in their skin, and we can learn a lot from them if we actually sit down and ask open-ended questions in our clinical encounters. And we also listen to their parents, especially when these kiddos are little. These parents know their kiddos better than we do. We get a little snapshot in time in the clinic, and we may be missing the forest from the trees. So sit and listen to your patients and listen to their parents so that you can provide the best possible care as a dermatologist. Then lesson number 3, patience and a positive attitude will get you far. And I think we know this, but as medical professionals, burnout is a huge thing. There are so many things that take us away from the things we love as physicians. And again, it's easy to get bogged down, but I think if you look at your patients and you see their resilience and their positive attitude, they are approaching so much. And I think if we can just really spend the time getting to know our patients and seeing how resilient they are, that's going to make us more resilient as well. And then lesson 4, be a good listener, be a good friend. We went into this profession as caregivers because we want to provide good care. And our patients want that good care too. So it's a win-win. So again, just really remember that you're not only there to be their physician and their advocate and the expert in the room, but you're also there to be their friend. And that is going to get you much more satisfaction out of the encounters, and your patients will actually walk away with better information and feeling supported. And we know that increases the rate of compliance with medications, with treatment plans, when you have that good interaction. And then lesson 5, don't underestimate the power of appropriate touch. So people with skin disease feel so shunned by our society. We know that. I think sometimes when we're in the clinical encounter, we forget that. And I know that it's important for us to wear gloves and wash our hands and do all those things, but most of the time, we don't need to have our gloves on right away, and it does scare children. That's a big tip, really, is if you walk in without your white coat on, and you walk in without gloves or gloving up, that's going to reduce the anxiety of the patient, and you'll really be able to see them kind of in their natural form, and you'll be able to examine them again without even putting them up on the bed, because when we put our patient up on the bed away from their parent, we've removed their safety. So again, if we can just remember that touch is so important, and again, so many of these kids have felt shunned, and it's hard to live in their skin. So when you just put your hand on their arm and let them know that it's okay, that speaks volumes without even saying a word. And then again, our campers learn tons of lessons when we send them. So again, send all your patients to camp. They learn how to be silly. They learn how to have fun. They learn how to succeed. They play games where they can succeed. And again, this is all just in having fun. They also learn how to look at things from another person's perspective. It's sometimes the first time these kiddos meet somebody with the same skin condition, which is huge. It makes them feel not alone. But then they realize, oh my gosh, there's all these other kids that are having a similar lived experience, and their eyes are open to things that they may have to do differently for their skin. They learn how to see no evil, speak no evil, and hear no evil. And those are powerful tools for them to take with them from the campgrounds. And they learn that while their skin conditions are different, they have very similar struggles. And again, that's so important in helping them not feel alone, which is probably the biggest benefit and the best medicine from camp. They also learn that there are others who understand them. So many patients feel like nobody understands what it's like to live with a visible condition. And we know that when we go from room to room because of HIPAA, we can't share those experiences, but we hear the same story time and time again. And this is a way for them to unite around that common lived experience and realize that there are others who understand. They also learn to be lifelong friends. And as we know, friendship is really a true gift that lasts forever, despite sometimes moving on, because these kiddos, we know some of them are going to pass earlier than they should, and they learn important lessons about learning how to cope with the loss of a friend. And that's hard, but it's a good lesson to learn early, and it makes them more resilient. They also learn how to be themselves. It's great when you come to camp, you see these kids and they're buttoned up and they have their hoods pulled up and they have their hats and their wigs on. But by the end of the week, it's so refreshing to see them jumping into the pool without their wig on, without their camouflaging makeup. And again, it just lets them put down that invisible armor that they wear out in public all the time. They also learn to have a sense of inner peace. Camp is a way for them to come into a safe space and to really be vulnerable, sometimes for the very first time outside of their family. And again, it lets them see that they can do hard things. And those, again, are lessons that live on long past the one-week camp experience. And they also learn that they can be accepted just as they are. Sometimes it's the first time that these kids feel comfortable in their own skin, and when they leave, it empowers them to continue to feel comfortable and not cover as much when they're out in public. And they can learn, again, that they can do really hard things. I think this builds our resilience muscles in these kids, and I think it builds our resilience muscles too when we go in as the camp volunteers, because we live through some things that are really hard. You work really hard at camp, but again, the dividends that you get that pay out just not only in your life immediately, but in the way that you take care of patients and the way that, you know, you have patient interactions in the future are just, you know, wonderful gifts that you can't get out of a textbook. They learn to be superstars in their own unique way. We have so many camp programs and initiatives that help them realize that they are special, that they were made a masterpiece just as they are. So it really empowers them, again, to walk out of camp so strong. And again, that can be the best medicine we can give for our patients. They also learn that they can be everyday heroes. That was one of our theme one year, was everyday heroes. And I think as dermatologists, we're everyday heroes to our patients, because these encounters at camp, they are really changing lives. And again, those ripple effects live on in these kiddos' lives. They come back to be counselors, and they go on to lead highly productive lives, loving the skin that they're in. And again, camp is really the beginning of that for so many of these kiddos that go on. So as a dermatologist, you have the gift of camp to give to your patients. And it's very easy to do. And really, camp is the best medicine that you can give to your patients, better than any prescription that you're going to write, anything that you do for your patient. If they are struggling at all socially, emotionally, if they're uncomfortable in their skin, camp is going to change that more than any topical steroid, oral medication that you can give them or prescribe. And the great thing is it doesn't require a prior authorization. Camp is free. All of these camps, the Camp Discovery through the Academy of Dermatology, Camp Wonder through the Children's Skin Disease Foundation, and then Camp Spirit through the Butterfly Children's Fund are all completely free to these campers. They are flown in from across the country. Their room and board is paid for throughout the camp stay, and then they go back home as changed people, really changed people, changed children who are no longer defined by their skin disease, and they can be empowered to wear their skin comfortably in public. How can you get involved? There are 3 easy things that you can do to get involved. Send your patients. Again, a 1-page application, so easy. Volunteer your time. Again, it is a 1-week experience. You're going to leave very tired, but you're also going to leave so fulfilled. So volunteer your time. And then if you can't get to camp, send your money. Camps need money to continue to get these kiddos there. So again, send your patients, volunteer your time, and donate your money. either Camp Discovery, Camp Wonder, Camp Spirit. They are all paid for and free to these kiddos. So again, please refer your patients to these life-changing experiences. It's the best medicine that you can give them, honestly. And then I just want to end with one of my favorite quotes that resonates so much by William Osler. You might know him. He's a pretty famous guy. And his quote that, again, I think is important for all of us as dermatologists to remember is: a good doctor treats the disease, but a great doctor treats the patient who has the disease.